Hello everyone. In this video, we are going to discuss about coping with loss of normalcy. Regardless of the individual developmental route, most children start realizing that they are not quite like others at some point during their adolescence. Once the adolescent realizes that he or she has significant difficulty in conducting relationships compared to their peers, they need to deal with this loss just like any other loss. Understanding the thoughts, feelings, and behaviors of an adolescent is a necessary first step in helping them out and being there for them. Considering this coping process in a few stages may make the caregiver's job easier. One of such stages is denial. In denial, the person may say, "This can't be happening to him or her." In anger, the person may say, "Why is this happening and who is to be blamed about it?" In bargaining, the person may say, "Make this happen and in return, I will give you something or I'll do something for you." In depression, the person may feel too sad to do anything. And during the final stage of acceptance, the person will have peace of mind with whatever had happened. Most commonly, the adolescent will not go through these stages one after another, but rather display a larger or smaller aspect of each at any given time. This is a painful process for not only the adolescent, but for others who care for him as well. Parents may find themselves compelled to forget the whole thing and act as if nothing is happening. Denial is one form of getting over the problem. It is important for parents to help the youngster not to deny, but to face the problem and handle it appropriately. Now, let's move forward and discuss how to help when coping with loss of normalcy. Help the youngster talk about his anger and frustration, which will in turn help the adolescent get closer to acceptance and adaptation. Parents do not have to bring up any topic or take initiative and give an impression of intrusion. Instead, if they give a good listening and show patience to the youngster when he or she brings about a problem, will go a long way in easing the situation. By the way, listening is the best gift one can give to the loved ones. When the youngster is making statement about the problem, stay on the problem without changing the topic unless the youngster changes the topic. This would give confidence and trust to the youngster in regard to the parents that they would listen to him and he can trust them to be patient with his anxiety and concerns. This adds the youngster's self-esteem also. It is important for parents to be in line with the youngster, listen to the difficulties, and not to trivialize or minimize the problem, but understand the problem entirely from the point of view of the youngster. At the same time, parents should also not allow the youngster to exaggerate an issue. They should provide the youngster clues for reality testing in a gentle way. It is important to remember that everyone copes with loss differently. While one may find that they experience all 5 stages of grief, they may also find that it is difficult to classify their feelings into any one of the stages. Have patience with oneself and their feelings with dealing with loss. Allow them with time to process all their emotions, and when they are ready to speak about their experience with loved ones or a healthcare professional, do so. If parents find the youngster depressed, they could consult a psychiatrist and get the needed medication to overcome the depression. It is important for parents to look for the following symptoms of clinical depression. If 5 or more of these are present week after week, then it is indicative of definite depression and the youngster needs immediate help. Thank you for watching. For more such informative videos, please subscribe us.